So this is a spinal cord model, and this is the anterior surface, anterior median fissure going down. There's some areas that are enlarged, cervical enlargement, and the lumbar enlargement. That's where we have a lot of cell bodies that are going to the upper limbs or the lower limbs. At the end of the spinal cord, we have this little pointy area called the conus medullaris. That's the end of the cord. Now, during development, the cord does not grow as fast as the spine, so that's why it ends before the spine ends. Coming off the tip, we have a little bit of pia mater coming all the way down. That's called the filum terminale. It will join with some of the dura mater to form the coccygeal ligament that's attached down to the sacrum and helps prevent the cord from bouncing up and down. Also, there's pia mater coming out of the sides here that join up to the dura mater. These are called denticulate ligaments. They hold the cord also so it doesn't move back and forth sideways. You can see the spinal nerves coming out between the intervertebral foramina. 8 spinal nerves in the cervical region, because one comes out above the atlas, 12 thoracic, 5 lumbar, 5 sacral, and only 1 coccygeal. Now, the nerves are named for where they come out, not where they originate. What we see down here too, these are roots, sensory and motor roots, before they've joined to form the spinal nerve. This is called the horse's tail, or cauda equina. Also in this model, you can see part of the sympathetic chain ganglia. It should extend up here. Okay, these are called the paravetrebral ganglia. They're on either side of the cord. There's also prevertebral ganglia that are in front of the cord. There are plexuses in the cervical region. Those treat mainly the head, the neck, a part of the shoulder. A very important nerve coming out of that area is the phrenic nerve. As I was saying, C3, C4, C5 keep the diaphragm alive. So that's a very important nerve because the diaphragm is the most important muscle for breathing. And that's near the sternocleidomastoid muscle. The brachial plexus mainly serves the upper limbs. And there's a thing, real tired, drink coffee. Roots, which were really rami, trunks, divisions, and cords. That's the order. And then we divide into the muscles. The nerves going to the muscles. They are sensory and motor. There's the axillary, musculocutaneous, radial, median, and ulnar nerves. And you should learn more about those on their own. We don't have a plexus in the thoracic area. We have intercostal nerves, or thoracic nerves. The lumbar plexus is in the psoas major muscle. 2 major nerves here are the femoral, which serves the quadriceps, for example, and the obturator, which serves the adductor muscles. That the obturator nerve is sometimes damaged in childbirth. The femoral nerve is often damaged, like in stabbings and gunshots. The sacral plexus has the biggest nerve in the entire body, the longest nerve, the sciatic nerve. Just above the knee usually is where it branches into the common peroneal nerve and the tibial nerve. We're going to serve the buttocks and the hamstrings with the sciatic nerve. The common peroneal nerve will serve the lateral muscles of the leg and the anterior muscles of the leg. The tibial will serve the posterior muscles, which is kind of surprising.